Welcome to the Michigan Trauma Quality Improvement Program. In this section of orientation, we will review pre-existing conditions. Pre-existing comorbid factors are those present before patient arrival at the MTQIP facility, ED, or hospital. Recommended data sources for finding a patient's comorbidities include but are not limited to H&Ps, consults, progress notes, scanned information from skilled nursing facilities, EMS run sheets, social history, rehab notes, and care everywhere. All data elements have links to the YouTube orientation video under Resources for your convenience. Advanced directives limiting care requires the presence of a written request to limit life-sustaining treatment that restricted the scope of care for the patient during the patient care event. The written request must be signed or dated by the patient and/or their medical power of attorney, if applicable, prior to arrival at your center. Do not report for patients with advanced directives that did not limit life-sustaining treatment during this patient care event. Please note that the verbiage "present prior to arrival at your center" is not limited to documentation in hand or scanned into the EMR from a previous admission. Present prior to arrival is defined as the medical record indicating that the patient has an advanced directive that limits care and was completed prior to arrival at your center. Trauma patients are often brought into the ED in an emergent manner. Advanced directives may not be available to healthcare providers immediately and are often brought in by family members at a later time. Alcohol use disorder reporting requires that the patient drinks greater than 2 ounces of hard liquor, greater than 2 12-ounce cans of beer, or greater than 2 6-ounce glasses of wine per day in the 2 weeks prior to admission. This can come from patient admission or from information provided by family or friends. This pre-existing condition should also be reported if the patient meets criteria for alcohol withdrawal syndrome during their hospital stay. If the patient is a binge drinker, divide out the total number of drinks by 7 days, then apply the rule under description. For example, if a patient reports drinking 8 to 10 beer on Fridays and Saturdays, you would multiply 8 by 2 days, giving you 16 beer total. This meets the criteria of greater than 2 beer per day. Another example would be a patient who reports drinking a pint of liquor every week. A pint consists of 16 ounces, which meets the criteria of greater than 2 ounces of hard liquor per day. You may also determine inclusion based on the brief screening tool used at your institution. Do not report on patients less than 15 years of age. Anticoagulant therapy as a comorbidity includes patients with documentation in their medical record of administration of medication that interferes with blood clotting prior to injury. These meds include anticoagulants, antiplatelet agents, thrombin inhibitors, factor Xa inhibitors, thrombolytic agents, or similar agents. Exclude patients who only take aspirin for anticoagulation. Anticoagulants captured must be an active medication taken within the timeframes provided in the table. This table is a guide and may not include all anticoagulants. We have provided a hyperlink in the data dictionary to assist you in looking up anticoagulants as needed. Antiplatelet is captured on patients who report use of an antiplatelet agent within a 10-day timeframe prior to injury. Common antiplatelets include Plavix, Effient, Pletol, and Brilinta. Do not capture aspirin under this variable. If you capture this variable, you must also report the comorbidity anticoagulant therapy. Aspirin is reported for patients who report the use of aspirin within a 7-day timeframe prior to injury. This includes patients who report using aspirin in the past 7 days for issues such as pain or headaches, and those who take low-dose aspirin on a daily basis for heart health, as well as those who take it daily as an anticoagulant. Patients taking aspirin-containing drugs such as Agrinox should also be reported. Attention deficit or attention deficit hyperactivity disorder refer to a disorder involving inattention, hyperactivity, or impulsivity requiring medication for treatment, present prior to ED or hospital arrival. Include patients with the ADD or ADHD diagnosis if documentation reports medication noncompliance. Autism spectrum disorder refers to a disorder involving problems with social communication and interaction, and restricted or repetitive behaviors or interests as well as different ways of learning, moving, or paying attention. This can be documented as autism, autism spectrum, Asperger's, etc. Beta blocker use is captured for patients who report use of beta blocker medication within a 2-week time frame prior to injury. Bipolar I and II disorder is reported on patients who have a documented diagnosis of bipolar that was present prior to injury. The minimum required documentation for reporting is bipolar or equivalent. Do not report on patients less than 15 years of age. Bleeding disorders refer to a group of conditions that result when the blood cannot clot properly. Examples include factor V Leiden, hemophilia, thrombocytopenia, and von Willebrand disease. Please exclude unspecified bleeding disorders and sickle cell disease. Bleeding disorders include disorders that both decrease and increase clotting factors. Cerebrovascular accident refers to a history of CVA prior to injury with persistent residual motor, sensory, or cognitive dysfunction. This includes deficits such as hemiplegia, hemiparesis, aphasia, sensory deficits, or impaired memory. CVA can be embolic, thrombotic, or hemorrhagic in nature. COPD is a lung disease characterized by a persistent blockage of airflow that interferes with normal breathing and is not fully reversible. The terms chronic bronchitis and emphysema are included within the COPD diagnosis. Do not report patients whose only pulmonary disease is acute or chronic asthma, diffuse interstitial fibrosis, or sarcoidosis. Reporting criteria include functional disability from COPD, hospitalization in the past for treatment of COPD, patients requiring scheduled or PRN bronchodilator therapy, or an FEV1 of less than 75% of predicted on pulmonary function testing. Do not report on patients less than 15 years of age. Chronic renal failure is reported for patients who required peritoneal dialysis, hemodialysis, hemofiltration, or hemodiafiltration prior to injury. Exclude patients who may have required dialysis or filtration in the past but no longer require or are receiving it. Cirrhosis is reported if there is documentation in the medical record of the patient having a history of cirrhosis, which might also be referred to as end-stage liver disease, prior to injury. Exclude patients who no longer have cirrhosis due to a successful liver transplant. Cirrhosis should also be considered present and reported if documented by diagnostic imaging studies or by a laparotomy or laparoscopy. You may also see documented child or MELD scores that support evidence of cirrhosis. Congestive heart failure is defined as the inability of the heart to pump a sufficient quantity of blood to meet the metabolic needs of the body, or can do so only at an increased ventricular filling pressure. To be included, this condition must be noted in the medical record as CHF, congestive heart failure, pregnancy-induced congestive heart failure, a type of HF, or pulmonary edema with onset or increasing symptoms 30 days prior to injury. The 30-day interval criterion applies only to pulmonary edema. Report only on patients 15 years or older. A current smoker is a patient who reports inhaling nicotine by smoking cigars, pipes, cigarettes, e-cigarettes, vaping, or juuling every day or some days within the last 30 days. Do not report on patients who only chew tobacco or snuff. Vaping and juuling includes vape pens, dab rings, mods, pod mods, or any other electronic delivery system used to inhale nicotine. Chemotherapy for cancer refers to a patient who is currently receiving chemotherapy treatment. Chemotherapy may include, but is not restricted to, oral and parenteral treatment with chemotherapeutic agents for malignancies such as colon, breast, lung, head and neck, and gastrointestinal solid tumors, as well as malignancies such as lymphomas, leukemia, and multiple myeloma. Exclude if treatment consists solely of hormonal therapy or cell cycle inhibitors. Drug search and therapy type hyperlinks have been provided in the data dictionary for your use as needed. Dementia refers to documentation in the patient's medical record of dementia, including senile or vascular dementia, for example, Alzheimer's dementia, present prior to injury. Although there may be detailed dementia diagnoses, the minimum required documentation for capture is the wording of dementia or equivalent. Diabetes mellitus refers to patients with the diagnosis of diabetes who require treatment with a medication to lower or control glucose or A1C levels prior to injury. Include patients with documented prediabetes requiring treatment with a medication to lower or control glucose or A1C levels. Do not include patients whose diabetes is controlled by diet alone or if there is documentation reporting the patient has not been taking a medication. Please exclude patients using medication for weight loss alone without the diagnosis of diabetes, for example, medications such as Ozempic. Direct thrombin inhibitor should be reported for patients who have used a direct thrombin inhibitor class medication, such as Pradaxa, within a 2-day time frame prior to injury. If you capture this variable, you must also report the pre-existing condition of anticoagulant therapy. Disseminated or metastatic cancer is cancer that has spread to one or more sites in addition to the primary site, and in the presence of multiple metastases indicates the cancer is widespread, fulminant, or near terminal. A diagnosis of cancer that has spread to one or more sites must be documented in the patient's medical record. We have provided different types of leukemias, lymphomas, and myeloma that should be included versus excluded for capture. If disseminated cancer is first diagnosed during the patient's current hospital stay, please capture this pre-existing condition. Factor Xa inhibitor should be reported for patients who have used a Factor Xa inhibitor class medication, such as Eliquis or Xarelto, within a 2-day time frame prior to injury. We have included drug search and example links in the data dictionary for your convenience. If you capture this variable, you must also report the comorbidity anticoagulant therapy. Functionally dependent health status includes patients who, prior to injury, were partially or completely dependent upon equipment, devices, or another person to complete all or some activities of daily living due to cognitive or physical limitation. Activities of daily living include bathing, feeding, dressing, toileting, and walking. Include patients who use a cane or walker for ambulation, who require chronic home oxygen, or are ventilator dependent. Do not include patients who only use tools such as prosthetics or dentures, or that have implanted devices such as pacemakers or LVADs. Hypertension refers to a history of elevated blood pressure, requiring antihypertensive medication prior to injury. There must be a documented diagnosis of hypertension in the patient's medical record. Exclude patients whose hypertension is controlled only with diet or exercise, or if documentation notes medication non-compliance. Major depressive disorder is reported on patients who have the diagnosis of depression documented in their medical record. This diagnosis must be present prior to admission and not merely diagnosed following the trauma or injuries they are admitted for. The minimum required documentation for reporting is depression or equivalent. The wording of major or disorder is not necessary. Do not report on patients less than 15 years of age. Myocardial infarction refers to the history of a non-Q wave or a Q wave myocardial infarction in the 6 months prior to injury. The data element Other should be reported for chronic comorbid conditions that are present prior to injury but are not individually listed as a pre-existing condition. Other mental or personality disorders encompasses several disorders that are not otherwise specified as single diagnosis reporting. There is a provided list of diagnoses that fall under this pre-existing condition and must be present prior to injury. The minimum required documentation for reporting is the disorder type, such as anxiety, antisocial, borderline personality, or equivalent. Do not report on patients less than 15 years of age. Peripheral arterial disease, or PAD, is the narrowing or blockage of the vessels that carry blood from the heart to the legs. It can occur in any blood vessel, but is more common in the legs than the arms. Include peripheral vascular disease, or PVD, which is often used interchangeably with PAD unless vein-only disease is specified. Exclude diseases not caused by atherosclerosis, such as Raynaud's and Buerger's disease, or diseases not in the peripheral vasculature, such as coronary artery disease, or CAD. Do not report on patients less than 15 years of age. Report post-traumatic stress disorder when there is diagnosis documentation in the patient's medical record. This diagnosis must be present prior to admission and not merely diagnosed following the trauma they are admitted for. Do not report on patients less than 15 years of age. Report pregnancy when confirmed by lab, ultrasound, or other diagnostic tool or the diagnosis of pregnancy is documented in the patient's medical record. Schizoaffective disorder is reported when there is diagnosis documentation in the patient's medical record. The minimum required documentation for reporting is schizoaffective or equivalent. Do not report on patients less than 15 years of age. Schizophrenia is reported when there is diagnosis documentation in the patient's medical record. This diagnosis must be present prior to injury. Do not report on patients less than 15 years of age. Report statin for patients who report use of a statin-class medication within a 2-week time frame prior to injury. We have included a drug search link under Resources for your convenience. Report steroid use on patients who report regular use of oral or parenteral corticosteroid medications, such as prednisone and dexamethasone, within 30 days prior to injury for a chronic medical condition. Examples of chronic medical conditions that may require treatment with corticosteroids are COPD, asthma, rheumatologic disease, rheumatoid arthritis, and inflammatory bowel disease. Exclude corticosteroids administered topically by inhalation or rectally. Steroid eye drops also do not meet reporting criteria. Substance use disorder is reported for patients with descriptors documented in their medical record consistent with the diagnostic criteria of substance use disorders, specifically cannabis, hallucinogens, inhalants, opioids, sedative, hypnotics, and stimulants, such as patient has a history of drug use, or patient has a history of opioid use. It may also be documented as substance abuse disorder. Please note that the word disorder is not required for capture. Include patients who have a positive or unconfirmed positive drug screen for a non-prescribed drug. Report positive drug screen results documented in an autopsy report provided capture criteria are met, and the substances were non-prescribed and not administered by healthcare providers. The ventilator dependence element captures trauma patients who are ventilator dependent with a tracheostomy prior to injury. If a patient meets criteria for ventilator dependence, also report the pre-existing condition of functionally dependent health status. Warfarin is captured for patients who report the use of warfarin or Coumadin within a 5-day time frame prior to injury. Thank you for watching.